Extrapyramidal symptoms and tardive dyskinesia. When a substantial number of D2 receptors are blocked in the nigrostriatal DA pathway, this will produce various disorders of movement that can appear very much like those in Parkinson's disease, therefore sometimes called drug-induced Parkinsonism. Since the nigrostriatal pathway is part of the extrapyramidal nervous system, these motor side effects are also called extrapyramidal symptoms or EPS. Now, if these D2 receptors in the nigrostriatal DA pathway are blocked chronically, they can produce a hyperkinetic movement disorder known as tardive dyskinesia. This movement disorder causes facial and tongue movements such as constant chewing, tongue protrusions, and facial grimacing, and also limb movements that can be quick, jerky, and choreiform. The D2 receptors in the nigrostriatal pathway are hypothesized to become supersensitive or to be upgraded, that is, increased in numbers, perhaps in a futile attempt to overcome drug-induced blockade of D2 receptors. About 5% of patients maintained on conventional antipsychotics will develop TD every year, that is, about 25% of patients every 5 years. The risk of developing TD in elderly subjects may be as high as 25% within the first year of exposure to conventional antipsychotics. Interestingly, if D2 receptor blockade is removed early enough, TD may be reversible. This reversal is due to a resetting of the D2 receptors by an appropriate decrease in number or sensitivity. But after long-term treatment, the D2 receptor apparently cannot or do not reset. However, risk diminishes considerably after 15 years of treatment. A way to predict those who may develop tardive dyskinesia is patients who develop EPS early in treatment and may be twice as likely. In addition, specific genotypes of dopamine receptors may be important genetic risk factors. A rare but potentially fatal complication called the neuroleptic malignant syndrome, associated with extreme muscular rigidity, high fever, coma, and even death, possibly related in part to D2 receptor blockade in the nigrostriatal pathway, can also occur.